Okay, we're going to go ahead and get started on our engagement lounge today. It's so good to see everyone this afternoon. I'm Diane Cole, and I am at headquarters with the Cancer Patient Education Network. Thank you for joining us for the CPEN Engagement Lounge on Community Conversation, Creating Inclusive and Equitable Patient Education Programs and Resources. We have two excellent speakers and moderators today, Maritza Nassif and Tori Baggio from Dana-Farber Cancer Institute. Before we get started, I want to go over just a few quick housekeeping announcements that you can see on your screen. Everyone has been muted upon entry in order to limit background noise. Unless you're called upon to speak or would like to say a few words, please stay muted. If you have a comment or question, you can unmute so that you can make those comments, because this is going to be an engagement lounge that will include discussion. You may also use the chat function to ask questions. This is also under the participant menu, or it might be located under the More section on your Zoom screen. If you need technical assistance, you can certainly use the chat function for support. Statements expressed by the moderators and attendees are those of the participants individually and do not represent the opinion or position of the Cancer Patient Education Network. And finally, I just want to let you know that this event is being recorded, and if you do not wish to be recorded, you might not want to speak through you might not want to unmute and speak. During the discussion today, you may turn on the live transcript option for closed captioning. This is located in the top left corner of your screen. And before we begin our discussion, I would like to invite you to save the date for our next International Cancer Education Conference. This conference will be held virtually, and the dates are October 12th through the 16th this fall. It promises to be a very informative program and as well as an excellent networking opportunity. In addition, if you have not joined CPEN, we cordially invite you to be a part of this organization. You can find more information on the website, cancerpatienteducation.org. We welcome educators who work in hospitals who are not specifically in cancer patient education, and much of what CPEN offers has universal applicability of the principles of in cancer. And we wanted to let you know that we will soon be offering a discount to CPEN members for the Health Literacy Advisor. This is a program soon to be available online, which allows you to improve the readability of your documents. Now we will begin our engagement lounge, and I will hand this over to our presenters and moderators, Maritza and Tori.
Hi, everyone, and thank you so much for having us today. We are so excited to be here to start this conversation, and we just want to acknowledge up front that we don't have the answers to all of these questions. We don't know the solutions, but we're hoping that as a community and as an organization, we can better support each other and our patients and families. So just a little bit of background on my role. I'm the program manager for patient and family programs at Dana-Farber, and that is in some ways separate from patient education. I am not responsible for creating our teaching sheets or our educational content that is Dana-Farber branded, but I am responsible for managing and coordinating our resource centers. And I'll just let Tori say a few words before we move on to the discussion questions.
Thanks, Maritza. Thanks, Diane. Hi, everybody. I'm Tori Baggio, and I'm the program coordinator for patient and family resources at Dana-Farber. And I work very closely with Maritza to coordinate our resources that are sent out to patients, and really excited to learn from all of you and how you're managing your patient education and resources and programs, and how we can all work together to better support each other in the work to create more representative content. So thanks all for joining today.
Thanks, Tori. So the way that we've really structured this session is we broke it down into 4 different discussion questions. And what we're hoping to do is just start with each one. And Tori is going to put these discussion questions in the chat, and then we'll take the slide down in a minute or two. But the idea is that as a group, we can, whoever feels comfortable sharing, can say what they're currently doing in their programs, what their commitments have been as an organization or as a patient education program. And we can just brainstorm with each other different ways where we can be more inclusive in our programming and our resources and our approach to patient education. I know that at Dana-Farber, it is an institute-wide initiative, but for us, we've been trying to figure out, well, what's the best way to accomplish this? You know, we don't want it to be an afterthought. We want it to really be integrated into every piece of our work. And that's come with its challenges. So we're really hoping to just have an open discussion. We're planning on giving around 10 minutes for each question. So if you'd like to contribute to the conversation, you can raise your hand, add it to the chat box, we'll call on you. And we can just have a really robust conversation amongst all of us. And we have a good group, so I'm hoping that this is helpful to all. The other thing that we hope to really get from this is if you have interesting programs that you're currently working on, if there's presentation topics that would be of interest to other CPEN members, we would love to hear from you. So just in the interest of time, we're going to get started, but our very first discussion question is, what are you currently doing in your programs? Has the virtual setting or telehealth changed the way that you get materials and information to patients? Lastly, what is the impact? So if anyone wants to start us off, you're more than welcome to. Thank you, Diane. And if you want to share your videos, we'd also love to see your faces. Hi, Terry. Do you want to start us off?
Sure, I'd be happy to. I work in patient education for the Stanford Health Enterprise. So I'm not in cancer every day, but that is part of my experience as a nurse. So cancer materials are my favorite thing to help edit and advise on. And so remember how we all used to have a cancer binder that was about that thick? We've made a starter guide now that looks more like a magazine size, covering just your basic information you need to know to stay safe for for symptom management generally. And then in addition to that, people will be given information for their specific drug treatment. For disease-specific information, many of you will remember the old NCI cancer solid tumor guides. And you know the NCI doesn't make that file available in a paper booklet format any longer. But because it's a .gov site, we can take that information and use it. So we made that information available for each solid tumor type to subject matter experts throughout our enterprise. They reviewed it, edited it, and now we are in our second version of a solid tumor guide for each of the main sites that was based on NCI content that was from the .org or from the website, but that has been now reviewed by our subject matter experts to make sure it meets their needs. So I'm really proud of getting rid of the big binder. I'm really proud of the solid tumor guides that we've been able to develop and make available. And we have a starter video for radiation and chemotherapy, but we used to have a starter class for drug treatment, and the pandemic actually kind of made that stop. And so now our nurse practitioners are sitting one-on-one with each new treatment starter. So I don't know if that's what you were looking for, but in a nutshell, that's some things that we're excited about here.
It's great.
I'm not a clinician.
It's great to know what you're doing. And I have just a follow-up question. Are those guides available in multiple languages? You know, are they online, or how are patients accessing them?
They're in print format. We do have them all available to peek at on our .org site. So actually, if you go to stanfordhealth.org and look at patient education, you'll see them. But we did translate 5 or 6 of the most frequently. What I did was I asked our cancer registries from our larger sites if they would let me know what their top 5 cancers were. And then I think that 5 and 6 were so close that we made, I think, 6 translated guides into Spanish.
All right, that's awesome. Thank you so much for sharing. Anybody else interested in Kathy Jenkins?
Hi, I'm Kathy Jenkins. I'm at MD Anderson Cancer Center in Houston, Texas. And I work in the Learning Center, which is our resource library for patients. And we've been closed since March of 2020. And it's just been really frustrating to try and interact with our patients. So we implemented very quickly a lot of virtual ways to get to our patients. We have a recommended resource platform that we have on a library platform that has all of the cancer information on different topics and different cancer types. And off of that, we implemented a chat function so that people who are in that are able to chat with the staff of the Learning Center. And we also had our EPIC electronic health records. We worked with the team to have a portal put in the patient's portal to the Learning Center. It's called Ask the Library, and we were able to get a super location in the patient's messaging right below their provider list. And so they pick their doctor, or then it's Ask the Library right after that. And we've had a lot of traction from that. Some of it is just general questions about the institution and about their schedule and their treatment and whatnot. But thankfully, we've had people who've also been looking for the resources that they need for their cancer diagnosis. So we've had to do a lot of virtual implementation of things to be able to get to our folks.
And Kathy, same question for you. Have those resources, do you have a lot of translated materials? Is the chat available to multiple languages? How is that working for you all? Oh, you're on mute. Kathy, you're on mute. Not sure. Yeah.
There we go. Okay. The chat's available to anybody. The recommended resources.
Oh, you're on mute again.
Okay, now, so the recommended resources are available publicly and the chat is available publicly to anybody who wants to access that. And then we've done a lot of targeted email as well to our patrons of the Learning Center. We keep an email list of all of them, and we've been able to send out monthly newsletter items and updates and things and whatnot, directing them to Ask the Library and the recommended resources.
Okay, thank you for sharing. Anyone else like to share? I'm trying to scroll through and see. Well, I can just talk about Dana-Farber for a second if there's no one else, but for us, we've been looking at multiple projects. So one of the projects that we've been involved in is our patient gateway site, which is essentially the patient portal where they can make appointments, chat with their physician. And at one of our satellite locations, we realized that there was a disparity between our main campus patient gateway usage and our satellite. So we are trying to create English and Spanish speaking videos that target those populations. So how to enroll, how to access it, why you would access it. So is it important to be able to connect with your physician or get your medical information firsthand? So we're trying to, advance ourselves and, connecting with patients more directly. We've also been very involved in creating more virtual programming. And Tori and I can talk about this more later, but trying to get closed captions for our videos has been really challenging. And just technology needs as far as being more diverse in what we're offering, translating our video content, making sure we have interpreter services involved in creating some of these videos. That's an extra step that takes more planning than just hitting record on a Zoom for us. So in our planning for 2021 and 2022, we're looking at what else can we do for, other languages, closed captions, subtitles, transcripts being available online. So there's just a lot more thinking of, how many modalities can we offer things in? And like I said, there's many challenges to that, but that's really why we brought this conversation to all of you. We're obviously at some point going to be back on site, but we want to keep the virtual offerings that we have, and we want to increase access to all. So that is where our focus is currently. Has anyone else come against similar challenges or have been working on similar projects?
This is Joyce Hendershot from the James Cancer Hospital at Ohio State. And I think we're all doing some similar things, but our big concern is with this virtual delivery of care, the digital divide is growing. The expectation that patients are okay to find information, receive information, search for information only digitally, and understand those platforms and how to use them. I mean, we have people that they need assistance sign up for their MyChart account. And so the expectation is really high, and all of the clinicians, they're very well versed in it. They've been forced into it, through virtual or electronic medical records. So we're trying to focus on what's our role as educators to help people like that. Can we be like digital Sherpas or something? Is there a way we can reach out in a way that really resonates with how they learn, and to convince our clinical staff too that it's okay to have a variety of ways that people learn and you can't just go all in on one thing because it's the newest, sexiest kind of way to deliver healthcare, when the majority of cancer patients are still in that sunset season of life, that didn't grow up with the technology. And certainly they can manage cell phones to an extent, but some can't even do that, or they don't have the internet. I mean, we have places in Ohio, Southeast Ohio, they don't even have the availability to use those kind of digital things. So I guess I'd be interested in other groups if that's been a thing that's bubbled up to the top with this, pandemic, and how the access has been really impacted in that way.
Yeah, and I think that goes to how telehealth has changed our programs, right? How do we operate when not all patients are coming on site each time that they're visiting our institutions? Does anyone else agree or have comments around that topic? And I can't see everyone, so please use the raise hand function or unmute yourselves.
Just looking in the chat, Maritza, and folks are just saying that they agree, and I'd like to echo that. And I think another consideration in this conversation is how the information is getting sent out to patients as well. So not only the information that's available, but the ways in which we're sending it out and how that's being marketed is also something to consider. And Joyce, I just really appreciate the conversation around access and the digital divide, because it is so true. So thank you for raising that.
Martha, I see you raised your hand. If you'd like to unmute, you're more than welcome.
Hi, good afternoon. My name's Martha Hickey, and Rebecca Colville is on here as well. We're both from Roswell Park Comprehensive Cancer Center in Buffalo, New York. And we opened back up in June. So we've been open almost a full year. I'm sorry, Kathy, to hear MD Anderson is still very closed, but so many creative ways you've put into place to get patients their information. We have a main resource center on our main campus, and then we have 2 satellite resource centers as well. And things have been going beautifully. We're still offering wigs. We did create a whole COVID policy of how to distribute the wigs, and we don't try them on people anymore. Our patient education information is still flourishing. Our chemo and drug therapy, infusion therapy program is one-on-one. So we're able to deliver that as well. Overall, I think we've used some new ways and new ideas, but we're pretty much back to where we once were, which is refreshing.
Thank you, Martha. We are still closed also from last March. So we're really struggling with how to reach patients that we're not seeing. So our digital access has really been our only access at Dana-Farber. But it's definitely refreshing to hear that you're back to what was once our normal. Anyone else have anything to share before we move on from this question? Does anyone have any comments on what you think the impact on patients has been? I know we've done a lot of proactive outreach through our volunteer programs and having our volunteers connect directly with patients to help them set up Zoom. And there's lots of frustration there and lots of, I guess, anxiety around, missing their appointment because they don't know how to use Zoom or just being uncomfortable with the platforms. Does anyone else have that? There's also some comments in the chat. It's almost like those that are not digitally literate are now a disparity. I would definitely agree with that. Catherine says, once we fully reopen, I still expect some patients will prefer to receive their education digitally. I definitely agree with that too. Tech Tuesday for hands-on help with technology, a drop-in for anyone who needed help. Kathy, that's a great idea. Anyone else?
This is Jackie I'm at Be the Match, the National Marrow Donor Program, and I agree with the issues around not forgetting that people use print and paper and those more basic tools for education. I would also say though that at least for our area of work, we've always kind of had to do a lot of digital stuff because we're a national organization working with patients across the country. And we do hear from people in some of our virtual telephone support groups and things like that, that they, especially for BMT patients, they can be so isolating to begin with that there's that flip side, the benefit of being able to connect with people across the country who you may not otherwise be in contact with, that can help with a sense of isolation that people can experience. But at the same time, we can't forget that people need the print resources as well, and everything can't just be technology.
I definitely agree. There's pluses and minuses to both, pros and cons. Just in the interest of time, I think we're going to move to question 2. But what is one commitment that we have made or you have made or can make to positively impact diversity and inclusion in our work? So this is around languages, around access to, whether it's digital or print, any type of disparity. How can we be more inclusive in our programs and our work? So Janine just said, yes, it creates a lot of anxiety and stress for many people trying to log on to Zoom visits. Does anyone have any ideas that, maybe if they've brought to their organizations and it just hasn't been possible, or you've run up against blocks or barriers in a project that you've tried to do? Or you're still planning it out maybe and don't have answers to this question right now? Terry?
I was just gonna kind of back up a bit to mention one of the things that we found is our vendor, we use Crames. And we do a lot of custom documents as well for all things, but cancer documents, supportive documents as well. But one of the things we found out is our vendor supplied content that has been translated doesn't necessarily meet our geography, our part of the country. And what really, really shone a light on that was COVID. When we had people from other cultures that were working in places that were at high risk for getting ill, all of a sudden we realized we needed languages like Oromo and Karen and Laotian. And so that was an interesting finding. So of course, the way to navigate that was we had to invest in some translation. And if you can imagine how things have changed with COVID, it resulted in frequent retranslations as we've adapted. So, sometimes, it's just a fact that it's very costly sometimes to serve multiple populations.
Definitely agree with that. It depends where you are. And even for our satellite locations, the top languages differ from our main campus. Kaylee, I see you have your hand raised. So I'd want to jump to you.
Hi, thank you. My name's Kaylee. I'm from Ovarian Cancer Canada, so up north, and a patient organization, not in a cancer center, but I've been really interested in hearing very similar views around the digital challenges. But at the same time, for our organization representing such a large geography, we've been really pleasantly surprised at some of our education programming that we've been able to deliver virtually, allowing not only geographic participation from people who haven't always been able to come out to events, or also from people who are too sick and tired and fatigued to come out to hear the experts, to hear researchers speak or clinicians speak. So people have been very appreciative of that, lack of a better word, silver lining of how we've shifted some of our programming from in-person workshops and events to a more digital platform. And I think just one of your questions around the struggles around diversity, that came home. We recently did a patient survey. It was trying to capture the patient voice of those living with ovarian cancer. And of course, when we captured the demographic information, it was a very Caucasian responding group. It was very highly educated, upper income. I mean, the type of patient population, I suppose, that is able to take the time to answer 110 questions on a computer, have the time to do that. And also from another aspect of diversity as an organization that is traditionally we viewed as women's health, also having trans men speak out and say that we are not being representative of, we called our survey based on a global study called the Every Woman Study, which of course was, the reaction was very much, this is not an inclusive and welcoming name for a study where you're trying to capture patient, feedback and voices. So I just thought I'd share those two examples just as, and we are hoping to really address some of our blind spots and some of the opportunities that exist to hopefully really invite a more diverse patient population from a class-based perspective, from newcomers to the country, language issues, and also in terms of gender. So I just thought I'd share those.
Thank you so much, Kaylee. I think that's all really important to keep in mind and remember. And something you said highlighted for me the fact that, being in person and talking to our patients and families is one of the biggest ways that we would get our information and knowledge of where our gaps were. And now it feels like we're a step removed from that. So we're not getting that immediate feedback of what works and what doesn't work. But there's also a lot of really interesting information in the chat that I want to point people to. And Suzanne, I don't know if you'd rather me read your comment, or you could just jump on if you'd like, if you're available. But she says her department's community facing, so they work very hard to have appropriate literacy levels for our geographical areas. They often work with our own materials, but also reach out to other public facing departments. So they have a language service department in-house that works well with us. Also really important to think of the trans community. So I'm glad you mentioned that, Kaylee. Terry, you created an LGBTQ cancer screening guide also. That's incredible. Is that external? So is that available to the public?
Well, I would certainly share it for your review. I have to say, I have had it vetted very carefully, and I vetted it with someone at Denver Health, and that's their area of expertise. And I was very proud of it, and I rolled it out. I don't think anybody's ordered it. So do you ever have that challenge where you make these beautiful things and then?
Yeah, I think that's part of the struggle, right? Marketing your resource centers, and especially now that a lot of it's digital, how do you get the word out? You're relying on the staff that are on site, and you have to redirect people constantly.
Mm-hmm. So I would happily share the information if anybody wants it. The brand belongs to Sanford, but I'm happy to have you take a look if you want.
Thank you. That's really good to know. And Lily, I see your hand is raised. Would you like to say something?
Yeah, I think that this is a great time to revisit
suggestions and opportunities that in the past might have been shut down due to budget, or they don't exist, or we're not sure how to go about that. I know that for our institution, one of the things that happened during the pandemic is that it became very clear that our is my chart, what we use for medical records for patients, and for them to have the app and use on their phone. And years ago, when we first adopted it, we said, we need that in Spanish for that's the dominant minority here in Utah. We're like, we need this in Spanish. And the answer was no, it's too expensive. We can't afford it right now. We're not even sure it exists. And now with the pandemic, that became extremely evident. And then as the University of Utah and Huntsman and our medical school took that approach of creating equity, we revisited that and say, hey, we're still waiting on this. And it now has been placed for our 2021 budget. So we should be getting it in the next year or so. They communicated with the appropriate people, and it will be developed in Spanish for our hospital and our clients and our patients. Another thing that I'm fighting for is a automated, I think it's called a medical alert. So my program serves specifically the Latinx community, but there's no way for me to go into the record, the medical record, and find that information in bulk. I need to depend on the referrals of nurses and doctors who are already very busy. So we're trying to create an alert where I will get that information every time a new Latinx patient is registered to come into our door, so I can reach out to them and provide my service. So those are things that in the past they said no, it was too hard, it was too expensive. We're not sure it's really needed. And now it's like, yes, it's needed. Let's move forward, because that's the commitment that we have made to ourselves as an institution, to our employees, and to our community. So I think this is a great opportunity. You know, if there's something in your back pocket that you've been keeping for a while, to kind of be like, hey, since we made this commitment, could this be part of it? And I think you'll be impressed with the response and how things have changed in the last year or so.
Lily, that's such a powerful point. And I think that's really a takeaway from today, is just revisiting your structure, what you're offering. If there's something that hasn't worked in the past, maybe it will work now. We're in such a different time than just, last year or a few years ago. So that's a really, really great point, and something for us all to remember. So thank you for sharing that.
Thank you.
In the interest of time, I'm going to jump to Tori for the third question, but we can always circle back if there's something that anyone wants to add. So I'm going to pass it to Tori.
Thanks, Maritza, and thanks everyone for such great ideas and conversation thus far. The next question that we had teed up was, what can we as an organization do to support each other in this work? So if folks have any ideas of areas of support that professionally you might benefit from it, other than just having these conversations, I think there is such a value of just raising these points and to Lily's point, just asking the appropriate questions. And now's a really great time to start that reframing and rethinking. But as an organization, if we can do anything to continue the support together and this collaboration, I'd love to hear ideas.
This is Joyce again at James at the Ohio State University. Our big challenge now is having metrics that really reflect the documentation usage of resources for patient education. And in the electronic medical record, there's limitations, especially many of you probably know when you have a third-party vendor, their content is limited in the area of oncology. So we have to create custom titles. But Elsevier, who provides the care plans, don't have oncology care plans, so you can't map much to anything. And if you've had to do this process, which we've done for a number of years now, you have to, when you map a title, a document to a care plan, it has to apply to all. So Elsevier has a care plan called oncology. Well, I can't put anything in there unless, with a specific diagnosis, because that individual would have that be sent to them in their bedside, chart, and it would have them thinking they have ovarian cancer, lung cancer, head and neck cancer, brain tumors, because it has to apply to all. So it's very limiting. And our administration is really pushing for us to get a dashboard, if you will, of showing our worth, I guess, a little bit, or to validate that education impacts outcomes and reduces hospital stays and trips to the ED. But I have not found in research either how are people able to do that. We can tell you how many orders we have for our print materials, how many health information requests we fill. Those kinds of things are very tangible and possible for us. But this electronic medical record, and I think people, clinicians document in different places, different ways, have created workarounds, because if you've been in IHIS or an electronic medical record, the number of clicks to get somewhere is mind-boggling. And we are not active IHIS users. My team are not, because we're not in a clinical role. So it's real hard for us to even relate to that kind of process for our clinicians. So I'd be interested if there's anybody that's got a good way of trying to extract data.
I think from a Dana-Farber perspective, again, metrics is always something that's challenging. And that's something that we've tried to be better at, especially with like diversity and inclusion efforts and pulling specific reports of what does our population look like. Yes, the utilization of certain resources doesn't always tell you much. You don't know the impact of that resource on that specific person, but it helps us kind of target where we're going. So if we see that something was super popular, this topic really worked, this live session was really good, and so were these resources, then we know we work on the right path, essentially. As far as what data I present to leadership, it would be something like, our live sessions got this many attendees, our virtual on-demand programs are getting this many a year compared to what it was in person. Our peer support program had a huge increase in 2021. Our volunteers are calling patients directly, hearing qualitative information from patients and families. But as far as, the medical record, it's really just direct referrals from physicians to our programs. So if we know that we had our ambassador, our interpreters talking about our resources, and that program started March 2020, and we saw a spike from the referrals in March to now, then we know that there was some sort of impact made by that specific program. So it definitely is a challenge, and you kind of have to have targeted ideas of what you want to measure and start off with those ideas. But that's across the board difficult as far as patient education materials and how we measure impact.
This is Jackie. I would add this is a little bit different just because it's from the National Marrow Donor Program perspective, but we've started something where we do a specific outreach to people when they have a search, their doctor starts a search of the registry. And through this outreach, they get some educational materials and a call from one of our patient navigators. And we're not able to get a hold of everybody and what they're doing. And so we don't use an electronic medical record because we're not a healthcare system. We have a CRM, but they're able to see at a large population level of like thousands of patients, that there is a difference in the people that we're able to get in contact with and provide that phone education and navigation support. Those patients are able to get to transplant faster and with fewer barriers than the population that we're not getting in contact with. So we're having to use that to show the effectiveness of our patient navigators and the education and support that they provide. And I don't know if there's a similar way of thinking within the healthcare system, but that's been helpful for us to be able to demonstrate the value of our program in more concrete numbers way, even though we know that each call, the person that on the other end appreciates that support, they're getting help and resources, but we can quantify it a little bit better.
That's awesome, Jackie. Thanks for sharing that. I see two points here in the chat. I just want to lift them up. And Kathy, did you want me to read your comment, or did you want to speak to that? Sure. So doing things virtually makes it difficult to assess health literacy levels. Our email conversations are now a little more specific, asking what level of information do you need, whereas in person you can weave that into the conversation. I think that's really, really great that you're asking that question specifically. of the patients. Something that brings up for me is, and sort of in tandem with Jackie, what you were saying earlier as well, we at Dana-Farber are folks who do the patient education, work really closely with our patient family advisory council. So when the information is being created at the get-go, getting the patient and family perspective as the documents are being created, and really weaving in the patient perspective from the beginning. So hopefully, and getting that voice at the beginning is helpful to meet the needs of the patient, and also just consider other voices that might not be representative on that council as well. So, and then Beverly, did you want to read your comment, or would you like me to? I'll go ahead and do it. Hi, everyone. Oh, thank you. Hi, everyone. I'm a physician interested in cancer education. I'm curious how much physician support you all get for your work and departments, and how physicians could support you more. Anybody have thoughts on that?
This is Lily. Physicians are a difficult population to reach, just because of how busy they are. And at our institute at Huntsman, all of our doctors are also part of faculty, so they're teaching at the medical school and doing research. So they have very full, very full schedules. One of the things that has been helpful is getting a champion from a clinic. If you can reach one doctor in that clinic and make them an ally, it becomes very, very nice, because they will tell their colleagues. They will say, hey, if you're struggling with that patient who happens to be Latino, call Lily, she'll handle it. She'll help you, she'll get you support. So I think that's one of the best things to do, is look for champions that will sponsor you and kind of bring your program to the forefront in different clinics. Nurses often have a lot of staff meetings and education meetings. Keep it short, keep it simple, go to the point, kind of pick 3 things to highlight about your program and insert yourself into their schedule. And one of the very first things for my program that I say is, I speak Spanish and I'm available. I'm in the building. You don't need to call anybody else. You just send me an email, tell me what you want to be done, and I'll email you saying it's been resolved. If we have questions, we can move from there. So kind of, showcase your program, and just be very clear about the highlights and how they can benefit and how they can help their patients better. Because I think that's one of the things that our physicians and nurses are always looking for. How can I reach patients that I don't necessarily speak the language, but I want them to feel welcome and comfortable? And inserting a navigator in the middle tends to work really well.
Tori, if you don't mind, I'd love to jump in and ask the question.
Sure.
I would actually turn that question around and say, how can we better get to physicians, right? Because I feel like that's not just physicians, nurses, social workers. That's my constant struggle of how do we make people aware. And Lily, like you said, I'm constantly attending staff meetings, sending emails, making sure we're in newsletters. But when you're in the room with that patient, how are you going to remember to refer to our programs? I think that's a struggle. So if there's any feedback you have for me, please let me know. I would encourage it and welcome it. In the meantime, I'll jump to Gila because I see your hands up and we can start with her.
Thank you, Maritza. I just want to, follow what Lily just shared with us. It's having a champion is really a key to the success in connecting with clinics and clinicians, and also constant outreach. If we think like we are there, we are a program that's been, part of the hospital I work at MD Anderson, and you think like, okay, a 40-year-old program or 35-year-old program, they should know we're here and they should come to us. It's not going to work that way. So constantly keeping the communication channels open, And again, revisit, like you already mentioned in one of the earlier questions, something that I think Judy mentioned, that a program that we thought it was not working in the past might be working now. A person that said no to you because they were busy, maybe they need your help now. And my experience, it's been like, I've been very lucky. We've been very lucky, I guess, at MD Anderson. Most of the projects that come to the Learning Center is just through clinicians. Doctors know the impact of education, and then they come to us. And so we have close relationship with so many of the clinics, like Integrative Medicine Center, Head and Neck Center, Gynecological Oncology, Breast Center. Anyway, so just keep the communication going, send an email, and don't feel like you're bothering them because they need help. Even that, I got a couple of projects, and the Learning Center overall, we got a few projects through the past year working with different clinics now.
Thanks so much, Gila. Just want to highlight some of the conversation going on in the chat. Folks are agreeing that the open communication with physicians is pivotal to this work, and Joyce highlights that it's varies with each service line. Often research efforts will intersect with patient education, and if patient satisfaction scores mention anything related to their learning experience while at the hospital, I think that's a really great point, just looping back to patient satisfaction as well. So thanks for raising that. And Jenny, did you want to speak a little bit about your physician education program? Well, I can just highlight the question. It says, yes, would love to know how to get to physicians. Jenny's team is going to be highlighting or starting a physician education program next year and are not sure yet what that looks like and would welcome any ideas. So if folks have similar programs in your locations, those are welcome as well.
Hi, this is Leanne Hallback from the Helen F. Graham Cancer Center. I wanted to just respond to that about, how to offer physician education programs, but like Marissa was saying, that attending staff meetings has been really helpful, but also before the pandemic, Lunch and Learn has been a real hit. Offering like a beverage and a snack at the meeting, but they bring their own lunch. Just having that ability to have that time set aside, that the nurses or the doctors are going to come to the Lunch and Learn every month for a different presenter, and that really helps get the word out there to keep it fresh, because we are on site, but limited. So the physicians are starting to gather together in smaller groups with their masks on, and also virtually have their meetings. So you would be present for their virtual meetings as well.
Those are great ideas. Thank you. I love the Lunch and Learn idea. That's awesome. If we're ready, we can move on to the fourth question, and we've discussed this a little bit, so I appreciate everyone's just conversation today on this. The last question was, what is holding us back from maximizing diverse programs and educational content? Just in the last couple of minutes before we wrap up, if anybody else had other thoughts on this.
I think for me and for us, I'll speak for Tori too, it's time. We are very aware that we're creating virtual content right now, but when we go back on site, we're also going to have to manage on-site programs. And I'm not really sure how we do that at this point in time. I know we'll figure it out and we'll create a balance, but it's not having the time to project manage all of these different initiatives that we have. So if it's recorded videos, if it's written content, if it's a digital resource center, in-person resource center, how do we decide what is most useful for patients? And I think the answer to that is all of the above. But with the team that we have and the time that we have, where does our focus lie? A huge point for us for 2022 will be languages and creating video content in multiple languages. We're not videographers. We're not a communications team. We don't have that talent, I'll say, but we have to figure out how to provide that content to our patients. So from our perspective, that's been the challenge, and we're trying to figure out how to work with that.
I think, Maritza, to your point, I think you're very much on point. For us, I agree with the time, but for me, it also comes back to infrastructure, right? So we all want to be all things to all people, and we have great ideas, and we know how to approach diverse communities, but we might not get that grant that we want to support another worker to do that program or to do that work. And so on top of time, I would add infrastructure, because a lot of that stuff is out of our hands to a certain degree, because it speaks to our centers at a larger place. And also, I think for us, because the amount of content we put out, because it's not traditionally patient education, because it's community facing, so I'm in a little bit of a different boat. We can't use the softwares to generate content. We write and design everything we put out. And so that, of course, involves a marketing department, branding, all sorts of things, you know. And we're, like I said, we're lucky we have language in-house, so that's really helpful. But you need all of the departments around you to also have the infrastructure and the time to support the things that you are churning out, because, you know, our teams always have great ideas, and all of these things on CPEN, and we share with each other. We're ready to take it to the next level with diversity and inclusion. How do we get the support from our centers for them to also, even when it's already important to the centers, because it's important here, but still it's challenging.
Great points, Suzanne. Thank you. Leanne, I see you have your hand up.
Yes, hi. I was thinking about asking, you know, Suzanne makes very good points about our centers having the time to dedicate to us, because through marketing and grants, because they're doing double time for everybody else because they're in the same boat, right? So, but I wanted to ask you if doing like virtual programming, does anybody do that and then mail out the program supplies to the patients who want to sign up for the virtuals? And do you guys even think that would even be, you know, advantageous? Would it work? You know, my problem is that only patients are allowed in the building, and they come in on the other side of the building, so I'm out of sight. So our library gets, you know, like a quarter of the visitors, obviously. But no, none of our programming is going on right now because we don't have that virtual component. And you need the marketing and you need the grant money, which I hear is out there, but it takes a lot of time to write grants. So I just didn't know if anybody had any feedback on mailing out and virtual programming. How do you do it? How do you make it happen?
Our virtual programming is all on Zoom, and then most of it's recorded and posted on our website. But we aren't mailing anything out to patients at this time. We wouldn't have the bandwidth, and our programs don't really require any additional materials or content. But I do know that our art studio is doing creative arts programs that people can register for, and then they will get mailed materials. So they handle it a little bit differently, but their programs tend to be capped at a certain number of people per session.
Hi, this is Jenny McClendon. Can you hear me okay?
Yep.
Okay, great. I just thought I would chime in there. We have done, I'm with the National Ovarian Cancer Coalition, and we have done some quality of life virtual programming this past year where we would hold 6 sessions. And we did, to the first 100 registrants, we did mail out participant packages, which included education materials. And according to the sessions, again, it was quality of life. So we did mail out some support materials like a yoga mat, things like that. We had the funding to do so. We don't have the funding to do so again this year, but we did do that for everyone. And on our survey, we did ask if the support package enhanced their ability to, cope with their side effects from treatment, or did it enhance their just their overall experience, their overall quality of life. And of course, as you would imagine, that response was 100% yes. But there's really no other way for us to track the impact of those. But I just wanted to address her question that yes, we did mail that out. But due to, as she just mentioned, capacity and budgeting, we will not be able to do that again this next year.
Thanks so much, Jenny. Just in the interest of time, we're coming up at 3 o'clock. So I just want to highlight what's in the chat here before wrapping up. Angela says access to expertise, resources, time, funding, and education to do all of these items, as others have stated. Susanna says for virtual programs, we email our participants PDFs so they can print. Not the most equitable way, but it's what we can manage at the moment. Susanna, that's a really great point, that not all the patients and families that we serve might have printers. So that's thank you for raising that. And then Suzanne says, we've been doing a combination of emailing with partners, printing out resources on site, and we've also done some mailing. We've also dropped off materials as well. We're trying to meet people where they are and as much as possible. And I think, Suzanne, that's a really, really great place to sort of wrap up, just working towards meeting folks where they are and being really, really keying in on the needs of the patients and the families that we serve, and continuing to have conversations like these to broaden our understanding of what the patient and family need is, and how as a community we can continue to have these types of conversations and make sure that what we're providing is as inclusive, as representative, and as equitable as possible. So it is 2:59, so we're right up on time. And I want to thank everyone so much for joining us today. Thank you to Maritza, Jackie, and Diane for helping to collaborate to put this together today. And if you all had anything to add here as we close up, I'd welcome that. The engagement lounge will be posted on the CPEN website. Diane put the link in the chat. Thanks, everyone. Great conversation.